Hi everybody. Um, I just want to clear up something, um, on my transformation of my cancer. Um, and just give an overview. And 12 years ago, like I mentioned before, I was diagnosed with non-Hodgkin's lymphoma, follicular, and it was low grade. The doctor or the oncologist, hematologist treated me with tablets and leucorin tablets for a year, seeing that it was on low grade, and this reduced the cells or the nodes to the point that they were no longer life-threatening. I lived with that, but just bear in mind that non-Hodgkin's lymphoma is not curable. It is just reduced. So it continues growing, but if it's low grade, it grows very, very slow. So you can live with it for a very long time. However, 10 years ago, I relapsed and back to non-Hodgkin's lymphoma. However, when I went for my scan, the doctor at the time, and I won't mention the doctor's name, nor will I mention the hospital that treated me. The doctor at the time, that was in November 2017, after he looked at my scan, after I had 3 rounds of very weak chemo, he had informed me that the chemo wasn't quite working, and therefore they would have to give me a stronger dose of chemo, of which they put me on R-CHOP. He also mentioned at the time that I had 2 kinds of cancer. One was, when I looked up on the screen, one was dull, which meant one section, or the non-Hodgkin's lymphoma, was very dull, which means it was still on low grade, but they also had 2 very bright lights shining, which meant that it transformed. When it transformed into diffuse large B-cell lymphoma, a very aggressive type, which was totally treatable and curable. I even read that up, back in 12 years ago, when I did some research on my cancer, that when it transforms, it can be cured. I forgot about that. The doctor at the time told me that he's got to find a way to treat both. He spoke about doing some radium treatment on the bright lights, because the size of the nodes wasn't all that big, and then treat the other one in another way. He was then going to remove the one that was in my abdomen, and then decided against it because he said it was too risky. Thereafter, it was forgotten. Transformation was never spoken about again, and I was never informed, and nothing was done to treat it. So we treated with R-CHOP up until July of 2018, and when I went for my scan then, it was told to me that the cancer had reduced again to a point where it wasn't life-threatening. However, the diffuse large B-cell was never mentioned. Carried on like that up until end of January 2019, when my legs swelled up and they sent me for a sauna to check on it. The sauna came back, no deep vein thrombosis, and everything seemed to look normal. I walked for a month like that, or for 3 weeks. I went back on my appointment date, and then I was sent for another scan And that was when they noticed that I had a huge growth in my hip area or my abdomen area, and one in my chest. And that is where I was told that I was cancer resistant and that there was nothing they could do for me. I had to sign. Then I was told I was going to be put on some kind of chemo, and together with what is it called, prednisones, to try and bring me comfort. But I had to sign that because they cannot do anything for me, I would then not expect to be healed. However, and that the chemo, it's a very, very mild chemo. It was just to make me comfortable. So now I'm dying. And I accepted that. I took 2 rounds of the chemo, and then I noticed that I was getting the side effects that I had the first time, and they were going to give me 3. I took 2, and I decided to stop the chemo because I was getting the side effects, and I didn't see why I should go through all that pain and suffering that I had from the first time, from a very bad chemo, for something that clearly wasn't going to work. So I declined, and the cancer grew. And then I had to sign the papers, and I'm just trying to think what happened after that. Yeah, things that had then progressed from there, slowly. No cure, I'm dying. They then referred me to hospice, and that was that. Then suddenly, out of the blue, the doctor decided, well, she wants to do some radiant treatment on me. But by that time, the cancer growth was rather large on my hip, in my abdomen, in my groin, on both sides. My kidneys was extremely painful, and they decided on radiant treatment. I declined again because I did not think that it was that it was going to work. I didn't believe it, not for 1 minute. And I wasn't going to put myself through any more tests and stuff because of that. I had already been referred to hospice as a dying patient. So suddenly this thing came to my mind. I don't know how it came about that, there we were with this transformation. I didn't even know what transformation was until I looked further into it and realized that I had diffuse large B-cell lymphoma, which was treatable and which was curable. So I feel that this hospital and these doctors had robbed me of 3 to 5 years of my life by overlooking that very, very important cancer and treatment. They were negligent. Now, ladies and gentlemen, friends, family, I'm asking, Mike, as we have decided, or I have decided, look, I don't have much time left, but my husband, I don't feel it's fair on him. He's been through hell and back because he's losing me to death. The final curtain for something that could have been corrected. My family has been through hell. Everybody has been through hell because of 2 doctors and their oversight. We have decided to look into it, lodge a complaint. We've also decided, if we can get to that, possibly have a lawsuit against this hospital. Now, because, with Mike and my struggle through the years, it costed us a fortune to maintain me. maintain my health during my sickness and otherwise. We took out loans to pay our bills and stuff like that. At the end of the day, Mike is going to sit with all of this, and I'll be gone. Literally gone. I won't be able to stand by him. I won't be able to help him through this. Whereas, had I lived, I could. We were busy trying to get our bills in order. Because every time I got sick, I had to leave my job. I wasn't in jobs where they give you this extra money when you get ill. You just have to stop. We lost our home, we lost our vehicles, we lost our insurance, we lost everything. And I mean everything. And here we are, once again, with nothing. And like I said, Mike sitting with the baby. Some of my family has decided that we cannot just leave it as it is. Someone has to answer to it. Now, at the beginning I said, Mike and I never ever ask people for money. We just battled along. But it's now come to that. We're not doing this purely for financial gain. Well, if there's anything in it for him, I will rejoice up there from heaven. That at least, he's being compensated and being helped out of this mess, this financial mess that we are in. And secondly, we're doing it also so that other cancer patients don't go through the same thing because of these doctors' oversights. So my family has decided to assist, but we're not from wealthy families. We don't come from wealth. We, from my family, has decided they're going to take on the battle with Mike. They're going to assist him and stand by him. And now with this, I'm asking my family, my friends, all those who stood by me to please stand by Mike with his battle coming up. From my family is going to try and get me on this GoFundMe thing and back a body. Somewhere, maybe people, you guys, whoever, will be able to just donate small amounts, to the fund, just to assist Mike with the legal battle that he might be facing, as well as to assist him, to have a peace of mind where it comes to his problems that both of us had, kind of created against our will. That is my story. I am furious. I'm disappointed. I am disillusioned by this hospital and its doctors, that because, we do not have money, we cannot go private, we cannot have medical aid and stuff like that. They can just treat us as we want, as they want actually, like nothing, just to save money. And I think that is totally unfair. So, if we can somehow get them to pay for their mistake, that would be awesome. To pay for what they have done, to pay for taking away my life, as if my life meant nothing to them. So, on that, my friends, my family, strangers, I thank you. I thank you for watching this video, and I thank you for, if you decide to assist, even if it's legal assistance, that would also be super awesome. We are not very educated people with legal eagles in our families, that could possibly do it. So if there's anybody out there, anybody that can assist us, or assist Mike, since I won't be around, to assist Mike, please open your hearts to him. I beg you. He's losing me. Don't let him lose his dignity and his pride in the process. I thank you from the bottom of my heart. God bless you all.